Thank you very much, Congressman Conyers, and all the other members of Congress who are standing here. And thank you, Dennis Kucinich, for running for president. And at each of the debates, bringing up this very important issue and requesting that our fellow Democrats state specific positions of how we're going to bring health care to all Americans and remove the profit incentive from health care. It has to be removed, and thank you for saying that over and over again. And all the rest of you for supporting Congressman Conyers' bill, H.R. 676. And I've been traveling the country with this film. It's going to open. It'll open in New York this Friday. It'll open around the country a week from Friday on June 29th. And I have been encouraging people to get behind H.R. 676. And I believe that there's going to be a groundswell of support because you're right, Congressman Stark. The American public is ready for this. They've been waiting for the opportunity. This is an issue that affects all Americans, regardless of their political stripe. When you get sick, sickness doesn't know Democrat or Republican. It's not a political issue. It shouldn't be made a partisan issue. We should find common ground with people across the political spectrum, because I can't imagine anyone, I would hope, in this body at least, that doesn't believe that every American has a human right, that when they get sick, they have a right to go to a doctor and not have to worry about whether or not they can afford it. So I so appreciate the work that you are all doing with this bill, and I ask Americans across the country who are asking me, what can we do? This is something you can do. Write to your member of Congress and say, get behind H.R. 676. So we live in a great country. Our fellow Americans, we know this. They have a good heart. They have a good soul. They know right from wrong. And eventually, when they're told the truth, they do the right thing. And what's hard is getting the truth out there. 14 years ago, Mrs. Clinton tried to do something. She stuck her neck out there to at least put the issue on the table. It wasn't necessarily maybe the right plan. We can have that debate's been had. But what happened is because of what happened to her in those 14 years, few political leaders have been willing to step forward and say we need to address this because they were afraid of the same thing happening to them. And so while they were afraid to have the courage of their convictions, the American people suffered for 14 years. But what's happened is that the health insurance industry and the pharmaceutical industry, through their tactics, through their price gouging, through their denial of care to our fellow Americans, they've done the organizing for us. They've turned the American people against the private health insurance companies. And the very first American word, actually, the very first American word was we. It's the first word in our founding document. We, the people, not me, the people. And this will only work when we realize that we have to operate from the we, that we're all in the same boat, that we sink or swim together. And when we have companies, pharmaceutical companies, the greed that's involved here, these companies need to be regulated like a public utility. They shouldn't be allowed to get away with what they get away with. Let me just give you just a little statistic. 30 years ago, there were 25 pharmaceutical companies working on cures and vaccines, 25 of them. Today, there are 5. Now, why is that? Because they realize there's no profit in finding a cure for something, because once you cure the disease, you can't sell pills for the disease for the next 30 to 40 years to that individual. And so they've stopped working on the very things that would lead us to a place where we wouldn't have various diseases or illnesses. And we've stopped working on the environmental factors that cause a lot of these diseases and illnesses. And as a result now, we have a country that's told every night on the nightly news, because that's where, right, virtually all the ads on the nightly news are pharmaceutical ads. They're being told to take this pill, that pill, whatever, all meant to line the pockets of the Halliburtons of the pharmaceutical industry. And we need to do something about this, the industry, and we need to regulate it. One other thing I wanted to say while I was here, you'll see this in the movie tonight. There are hundreds of 9/11 rescue workers who ran down to ground zero on 9/11 to help out. They weren't city employees or state employees. Some of them were volunteer EMTs. Some of them were firefighters from New Jersey that got across the river and came down there to help. And they ended up with very bad illnesses, ailments, diseases, mostly respiratory, as a result of their work down at ground zero. And they are not covered. They are not covered. They've not received the medical care that they deserve. And I would hope that this Congress would somehow take up this issue and say that the heroes of 9/11 deserve to be at the front of the line of the people who should be getting help. And the fact that they don't get help, and the fact that I had to take them to Guantanamo Bay, to our naval station down there, to try to give them the same free universal care that we give the detainees at Gitmo, the irony of that to me, was incredible. And so I'm hoping that perhaps these members and others can do something to help our 9/11 rescue workers who aren't getting the medical care that they deserve. Finally, the last thing I want to say is that you know, we hear a lot about the Canadian system, and you're going to hear a lot. The health insurance industry, Dennis knows this, they're going to be full force on me in this film in the next couple of weeks. And you're going to hear this story and that story about the Canadians, and they've got to wait and whatever. Go to the internet, go to my website, go to Dennis's, go to John's, go to other people, find out the truth about this, because we've been told so many myths about these other systems that actually do work. Yes, they have their flaws. All human systems do. But ask a Canadian if they would trade their national health care card for your HMO card. You won't find a Canadian willing to do that, or a Brit, or anyone from Ireland or France, or, you know, pretty much pick any Western industrialized country, because we're the last one that's willing to say that it is a human right to be able to see a doctor and not have to worry about paying for it. So thank you very much for having me here today.
Thank you. Thank you. Thank you, Michael. Michael is quite right. There was an ad in one of the papers today showing a line of little children saying, if this happens, you'll have to wait for medical care. This is what happens in Canada. And it's true. People do wait in Canada for medical care. But do you know who decides who waits and who goes first? Physicians. It's a clinical decision, not a pocketbook decision. We have people waiting in this country forever because they don't have the money. But in Canada, the doctor decides who goes first and who goes to the head of the line. I'm more comfortable with that.
That's right. And I also, and there is one line in Canada that I actually wouldn't mind waiting in if we had that line in this country. That's the line where Canadian citizens live 3 years longer than the average American because there's health care for everyone. That's the line I want to be in.